Good day and welcome to the first week and the first lesson on family nursing. We will be discussing the concepts of family nursing. This is the first video for this week and the objectives are the following. At the end of the session, you will be able to 1. Define what is family nursing. 2. Describe the 3 levels of family nursing practice and the respective goal of each level. 3. Explain the 3 theories that compose the conceptual framework of family nursing. 4. Contrast the 4 interventions nurses engaged in family nursing utilize. And 5. Gain a deeper appreciation of family nursing. We will begin with the definition of family nursing. Family nursing is defined as a specialty in nursing that deals with understanding people's experiences of health and illness within the context of the family as defined by the patient. In family nursing, nurses collaborate with families in reducing and alleviating emotional, physical, and spiritual suffering as a result of the illness. Family nursing is part of primary care provided to patients of all ages, ranging from birth to geriatric health. It is using the nursing process where nurses assess the health of the entire family to identify health problems and risk factors and assist in advancing and performing interventions to address health concerns and to improve the health of the individual and family. In family nursing, family nurses often work with patients throughout their whole life cycle, and this helps promote a strong relationship between healthcare provider and patient. The current practice of family nursing is based on 3 key basic principles. Number 1, health as a fundamental human right. Number 2, fairness in health and unity in action between nations, groups of people within countries and genders. And number 3, sharing and accountability of individuals, groups, communities, organizations, and sectors in health development. To better understand the important concepts of family nursing, this course uses a conceptual framework adapted from the WHO World Health Organization Regional Office for Europe 2000, which is a combination of 3 concepts. The 3 concepts are 1. The systems theory, 2. Developmental theory, and 3. The interaction theory. Let us first discuss the first concept, which is the systems theory. The systems theory views the system, either the individual, the family, and others, as an open system with parts and processes that have functional and structural relationships between the subsystems and the other systems. The second concept is the developmental theory, and this theory is crafted to appreciate the major life events all people undergo as well as the growth of the family. The third concept in our conceptual framework is the interaction theory. The interaction theory considers the interface and relationships between nurse and patient, nurse and family, concepts of partnership, collaboration, and teamwork central in the philosophy of primary health care. So how is family nursing practiced? Family nursing is practiced in 3 levels. The first level is on the individual level. The family is viewed as the context of the person, and the goal of the individual level is the physical health and wellness of family members. The second level is the interpersonal level, and this considers the family, and it is made up of dyads, triads, and larger units. The goal of the interpersonal level is mutual understanding and support of family members. The third is the system level. In the system level, the family is seen as a system having its own structure and functions that interacts with environmental systems and its own subsystems. The goal of the system level is change in the family system as a whole and strengthened compatibility between system and subsystems as well as between family system and the environment. Nurses engaged in family nursing implement 4 interventions, and these are: number 1, primary. In primary interventions, nurses assess for possible existence of harmful stressors or threats to health and work proactively to prevent these from impinging on the family. In primary interventions, the nurses help the family strengthen resistance resources, for instance, through health education. The next interventions nurses engage in family nursing implement are secondary interventions. In secondary interventions, nurses encourage the active participation of families in screening and immunization programs, for instance, through early detection of onset of health problems. The third is called tertiary. In tertiary interventions, the nurses encourage the involvement of families in rehabilitation and rebuilding of resistance resources. The fourth interventions nurses utilize is the provision of direct care. In provision of direct care interventions, the nurse works with the family or individual to attain either cure or rehabilitation or palliation or support as needed when an individual or family's coping mechanism has been breached. Nursing leaders assert that family nursing can and should be practiced by all nurses. They also assert that nurse generalists are prepared to care for relatively well-functioning families at the individual and the interpersonal levels. However, they caution that advanced clinical specialists of all nursing specialties with knowledge and skills in family theory and practice are recommended to care for the family system as well as advanced interpersonal level of family with dysfunctions. Nursing experts also remind us that caring is the essence of nursing. Nurse theorists Dr. Ann Boykin and Dr. Savina Schonhofer, in their theory of caring, asserted that caring in the nursing profession takes place every time a nurse-to-patient contact happens. The nurse enters the world of the patient in order to know the patient as a caring person, and that is when the caring in nursing begins to develop. Thus, the goal of nursing, including family nursing, is nurturing people, living, caring, and growing in caring. Before I close, let us be reminded that the mission of UPH is to provide holistic transformational learning rooted in Scripture. In the Scripture, the caring attitude expressed in a caring behavior is best exemplified by Jesus, who in one incident among many reached out, touched, and healed a man with leprosy. In Matthew 8 verses 1 to 3 we read, "When Jesus came down from the mountainside, large crowds followed him. A man with leprosy came and knelt before him and said, 'Lord, if you're willing, you can make me clean.' Jesus reached out his hand and touched the man. 'I am willing,' he said. 'Be clean.' Immediately he was cleansed of his leprosy." May we heed and follow the curative behavior shown in the Bible. Thank you.